Welcome to the Molybdenum Factor Risk Assessment Answers video. My name is Peter Walker-Birch and I will be your guide for today. Now at the start of the video, the first thing that you should have observed were that Bodie and Doyle were actually not wearing a uniform. In fact, Doyle was wearing a jumper and Bodie was wearing a watch. Local hospital dress code policies normally state that wristwatches must not be worn when providing clinical care, which includes examining patients. Jumpers and cardigans should also not be worn when giving clinical care to a patient. Strictly speaking, uniforms are not defined as personal protective equipment as defined by the COSH regulations. That said, NHS trusts normally consider the way employees dress and their appearance to be of particular importance in the way that portrays a professional image to all users of the service, whether they be patients, visitors, clients or colleagues. And so wearing a uniform is absolutely crucial within a clinical environment. You'll notice in this next scene that Doyle is not bare below the elbow. Now the World Health Organization recommend that long sleeves be avoided. Now this is because long sleeves have been found to be contaminated with pathogens, and they can also impede appropriate hand hygiene. Now there was an example of good practice when Bodie suggested to Doyle that he wash his hands. Bodie mentioned the 5 points of contact, which was a reference to the World Health Organization and the 5 moments of hand hygiene. You will also notice that Doyle was wearing a name badge secured with a black lanyard. Now, name badges are normally required to be worn within the clinical environment, but these are normally secured to your uniform pocket with a special clip. You're normally not allowed to use a lanyard to secure your identity badge within the clinical environment. This is because it is a potential strangulation risk, and also the badge can swing forward and potentially hit a patient when you're involved in close clinical care. There can also be a potential source of cross-contamination. In this particular scene, you should have noticed that Doyle did not roll up his sleeves on his jumper to facilitate effective hand washing. You should also have noticed that he was using cold water rather than warm running water to wash his hands. He also applied the soap before he'd even wet his hands. Warm soapy water is much more effective than cold soapy water at removing the natural oils on your hands, which holds potential bacteria. Doyle also did not use the correct hand washing technique, which is designed to protect against infection. Most healthcare associated infections are preventable through good hand hygiene and good hand washing technique. In this next scene, you'll notice that Doyle removed the excess water from his hands by tapping his hands against the sink. This means that his hands have now become contaminated again. You will notice that Doyle turned off the tap using his hands. Consequently, his hands have yet again become contaminated. He should have turned off the tap using either his elbows or using a paper towel. In this scene, you will notice that Doyle decided to dry his hands by wiping them on his jumper and his trousers, which is not appropriate. He should have used a paper towel to thoroughly dry his hands. Did any of you spot the dirty linen in the background that should have been actually inside the linen bag and not dangling over the edge of the bag? Now in this next scene there was an example of good practice as Bodie identified that the patient had MRSA, methicillin-resistant Staphylococcus aureus, and as a result the decision was made to use PPE, personal protective equipment. 2 common forms of personal protective equipment used within the radiology department are gloves and aprons. As you can see in this particular scene, Bodhi is actually applying some gloves, and you'll notice that the gloves are actually the incorrect size, and he's having to stretch the gloves to try and get them on. You will notice in this particular scene there are a number of risks. Firstly, Bodhi didn't wash his hand at all, and he's still wearing that watch. Also, he's not wearing an apron, he's just wearing gloves. If we turn our attention to Doyle, he's not wearing gloves, he's just wearing an apron. In addition, Doyle is wearing his ID badge over the apron. This means that the ID badge is at risk of becoming cross-contaminated with MRSA or any other kind of infection that the patient may have. In this particular scene, you will notice that there's a bloody blanket, which is a very serious infection risk. Now, this blanket should be properly disposed of in a red alginate bag and placed on a red linen basket. A clean blanket should then be provided for the patient. You should also have noticed that the X-ray tube is directly above the patient. Now, should the patient sit up, then the patient could potentially hit themselves on the X-ray tube, and so it needs to be moved out the way. In this scene, Bodhi can clearly be seen violently shaking the patient, which is not appropriate even if the patient is asleep or unconscious. Incidentally, you should also note that Bodhi's name badge, which is suspended on a lanyard, is actually in close contact with the patient, which is a potential cross-contamination infection risk, especially as this patient has an RSA. You should also notice that the kind of conversations that Bodhi and Doyle have in front of the patient aren't always appropriate. In this particular example, "Why don't you check the details, you're the nearest," is not a particularly professional conversation that you should be having in front of the patient. In this particular scene, Doyle actually demonstrated some very good practice in terms of his direction to Bodhi to check the wristband. This is to ensure positive patient identification. Positive patient identification is absolutely crucial within any clinical environment. As a general rule of thumb, if there's no positive patient identification, then there is no examination. You need to be able to check the name, the date of birth, the hospital patient number, or, if it is present, the NHS number. However, it turned out that the patient wasn't Mr. Larkin at all. Bodhi suggested that the patient was actually called Mr. Richard Wagner. However, on closer inspection of the wristband, you will notice that the patient was actually called Richard Wanger, not Wagner. It is absolutely vital that you cross-check any patient identifiable information on the wristband as well as on the radiology request to ensure that the patient in front of you is the patient that you are expecting. The examination should not go ahead if there is any doubt that the patient in front of you is not the patient that you are expecting. In this particular scene, it was quite clear that there was no escort for the patient. All vulnerable client groups that are being transferred from a ward down to the X-ray department should really be assessed for a nurse escort. This is particularly important in this case as the patient seems to be unconscious, and the nursing staff can help to positively identify the patient before the examination goes ahead. A particularly concerning example of bad practice in this scenario was that Doyle threw the radiology request on top of the patient's head. This is very disrespectful and unprofessional. In this particular scene, it is quite clear that Doyle is leaving the X-ray room still wearing personal protective equipment, i.e. an apron. All personal protective equipment should be removed and disposed of appropriately prior to leaving a clinical area. In this scene, Bodhi is clearly seen touching his sideburns with his gloves. Bodhi is now potentially cross-contaminated himself with any infection that the patient may have. In this particular scene, you can see that Bodhi is using an incorrect posture for manual handling. This is potentially putting his back at serious risk of injury. You will also notice that the height of the trolley is not conducive to effective manual handling. You will also notice that the bed rail on the patient's right-hand side is in the down position. This is very dangerous practice. The bed rail should be in the up position while the patient is being moved on the trolley. You may also have noticed that the indwelling urine catheter bag is actually dragging along the floor and could potentially be snagged while the trolley is being moved. You may have noticed in this particular scene that when Doyle came back into the X-ray room, he did not wash his hands again. Hands should be washed before and after patient contact. You may have noticed that the height of the X-ray table is much higher than the height of the patient's trolley. The height of the X-ray table and the trolley should be at a safe working height for the radiographer. For effective horizontal transfers of the patient to the X-ray table, the height of the X-ray trolley should be a little higher than the height of the X-ray table for lateral patient transfers using a PAT slide. Another potential risk is the weight of the patient in relation to the safe working load of the X-ray table. If the weight of the patient exceeds the safe working load of the X-ray table or any other radiographic equipment, then the patient should not be transferred onto it. Another key risk is that there are only two radiographers in this scenario, Bode and Doyle. A minimum of 5 radiographers are required to carry out a lateral patient transfer from an X-ray trolley to an X-ray table. In this scenario, a decision has been made to carry out the examination with the patient on the trolley. Given that there weren't sufficient radiographers around to carry out a lateral patient transfer onto the X-ray table, this was a good decision. There are potential risks with using some alternative projections. For example, a supine chest X-ray on a trolley will mean that the projection will be an AP projection rather than the preferred PA projection. Though in this instance this could be justified as they are looking for signs of infection. Supine chest X-rays also mean it may be more difficult to achieve the required 180 centimetre source image distance. Particular scene, Doyle quite rightly told Bode to put the brakes on the trolley. Brakes should always be applied when a trolley is in a stationary position. There was an indirect reference to a strategy called a dirty clean strategy, where you would have one dirty radiographer and one clean radiographer. We'll be talking more about this in the next section of the video where we start to demonstrate best practice. There were some other risks within this particular scenario. For instance, there was a bandage wrapped around the patient's left ankle. Now this could have been potentially covering up a sore which may have been infected with potentially MRSA. Also, the patient was connected to an IV drip, yet the IV drip was not in an IV drip stand. There was also a cannula in situ in the patient's left hand, which is another potential snag risk, which could result in the cannula being accidentally pulled out of the patient's hand. You should have noticed also that there was some rubbish and some medical equipment at the foot of the patient's trolley that should not have been there. Some of these were syringes, there was a vascular catheter, there was some old medication and some PPE gloves. These items should have been disposed of appropriately. It was quite clear in this scenario that the patient was wearing an oxygen mask. Unfortunately, the oxygen tubing was left dangling on the floor, which is a potential snagging risk. But more importantly, it should have been connected to an oxygen tank, as it is clearly there to provide the patient with sufficient oxygen whilst they're in the X-ray department. Whilst there was no drip stand used in this particular scenario, even though there should have been, it's worth taking a look at any of the equipment that gets brought into the X-ray department or into the X-ray room, because potentially it may be contaminated with blood. Any equipment contaminated with blood or any other kind of bodily fluid is an infection risk and should be cleaned up appropriately prior to the examination taking place. So, how many risks did you identify? Don't worry if you didn't get them all. The idea behind these videos are to sort of raise your awareness of the risks that you can often find within a clinical environment. The next part of this video will reiterate some of the points made and show you some of the best practice that you should be using when you enter the clinical environment.
Okay, so in this video, myself and Peter, as the contestants of the Molybdenum Factor, are going to go through and highlight all of the areas of bad practice that you saw in the video previously. The first area that I'm going to touch upon is the fact that neither Bodie nor Doyle were bare below the elbow. You'll notice that Doyle had a jumper on and that Bodie had a watch on. So first thing that they should have done was take the watch off, their lanyard off, and roll their sleeves up. First thing you would have noticed is that neither Bodie or Doyle were wearing a uniform. Wearing a uniform obviously helps adhere to the bare below the elbow policy. As well, Doyle was wearing a jumper. Again, this would not be acceptable in the clinical environment, again because it contravenes that bare below the elbow policy. You'll also notice that at the moment I've still got my wedding band on, and this is acceptable as long as it is a plain wedding band without any stones or anything like that, any indents, those sorts of things.
In the original video, only Doyle washed his hands, and even that wasn't done properly. To wash your hands effectively, you need to use warm running water. Ensure that you wet your hands before applying soap. Apply enough soap to cover all hand surfaces. Rub hands palm to palm, and then rub the back of each hand with the palm of the other hand with fingers interlaced. Rub each wrist with the opposite hand. Once you've finished, rinsed hands with warm running water. Use the elbow to turn off the tap. And then dry thoroughly with a single-use towel.
You'll notice that in the original video, Doyle wore an apron and Bodie just gloves. In the X-ray rooms, gowns are available and gloves are in 3 sizes: small, medium and large. Bodie's gloves are too small, and because of this he risks puncturing the membrane of the gloves. Now, both items of personal protective equipment, gloves and gowns, should be worn. If a patient has a transmittable infection, such as Clostridium difficile, then a dirty and clean radiographer should be employed. The dirty radiographer will perform the positioning, and the clean radiographer will operate the control panels and the X-ray tube. And this is to avoid cross-contamination of equipment. Okay, so a number of clinical waste hazards can be identified on the trolley and they need suitable disposal. Any instrument that can puncture the skin or cause injury should be disposed of in a hard plastics sharps bin. Now you'll notice here in the video that I'm taking the sharps bin to the patient rather than the sharps to the sharps bin. This is to reduce my risk of injury should I trip or fall. So another thing that we would need to change is obviously Mr. Larkin's soiled blanket and also anything else such as his patient gown or the sheets on the trolley that have also been soiled. So the blanket that was soiled with the blood would need to go into a red alginate bag, and that would go into a red linen laundry bag.
Just a word of caution when using the red alginate bags. When you're placing soiled linen inside a red alginate bag, you need to do so very, very carefully. This is particularly important in infections such as Clostridium difficile, which is spore-based, and these spores can be transmitted all over the environment. So you need to carefully place any soiled linen into the red alginate bag before then carefully tying a knot at the top of the red alginate bag and then carefully placing it inside a red laundry basket.
It's very important to ensure that when you're working with trolleys that they're at the correct working height for you and your colleagues. You'll notice that in the video, Bodhi struggles very much when he's moving the trolley towards the X-ray table.
You would have noticed in the footage that the X-ray tube was directly above the patient. This is clearly a risk to both the patient, who may quickly sit up and bang their head, but it's also a risk to the radiographer carrying out the examination when potentially you're trying to transfer the patient across onto the table. So we need to move the X-ray tube out of the way.
So when you're transferring a patient, one of the things that you need to be aware of is there anything that can become trapped or snagged while you're doing that. So things such as IV lines, oxygen tubing or urinary catheters, you need to make sure that they're in a safe place before you commence the transfer.